Starting with the name of Allah, the most merciful and almighty. My name is Kashif Ali. I am the student of BS Medical Lab Technology, Cohort University of Science and Technology. I am currently studying in 8th semester. Today the topic of my presentation is Helicobacter pylori, which will be submitted to our respected teacher Dr. Niaz Muhammad. So we are going toward our presentation topic. In this presentation we will briefly discuss about introduction, general characteristic, virulence factor, pathogenesis, transmission, epidemiology, diagnosis and treatment. So firstly, its introduction. The type of bacteria that infect our stomach and first part of small intestine, which is duodenum. This bacteria is mainly affect our small intestine, which is the part of our small intestine. Um, the Helicobacter bacteria is a gram-negative bacteria. It's a rod-shaped spiral rod and unipolar flagella. urease positive. So ये इसके जनरल इंट्रोडक्शन है. ये ग्राम नेगेटिव बैक्टीरिया है. इसका शेप जो है ये रॉड शेप है और यूरिएज पॉजिटिव है. और इसके अलावा now coming towards morphology and general characteristics. Its morphology is a rod-like spiral-shaped bacteria, flagella on one side, a smooth cell wall, catalase negative, oxidase positive, urease positive. So now we are going towards dynamics of H. pylori infections. This diagram shows general dynamics of H. pylori. Flagella, urease, exotoxin, secretory enzymes, type 4 secretion system, effectors, outer proteins, lipopolysaccharides. Now it's virulence factors, type 4 secretion apparatus, translocate category A and category 7 protein. It's not sorry, it's Cagolase A, Cagolase 7 protein, tyrosine phosphatase, chemokines, growth factor inhibitors. Now its pathogens and how pathogenesis. Sorry, its pathogenesis is starting. It means that how it is transferred to our body. Firstly, when we ingest this bacteria either in the food or in other contaminated food or from environment, it will bind to our body surface and enter to mucosal layer. In mucosal layer it insert its virulence factor and it's further goes to intracellular pathway. Now the transmission of uh, H. pylori, it's mainly occur in these following uh, categories. The first one is oral fecal route. ये हमारे मुंह और जो पखाना है इसके ज़रिए हमारे मुंह में आ सकता है और हमें इन्फेक्ट कर सकता है. ओरल टू ओरल थ्रू वॉमिटिंग, और ये ओरल टू ओरल भी पास हो सकता है, जैसे कि थ्रू वॉमिटिंग ये हमारे जिस्म में इंटर हो सकता है. ड्रिंकिंग इन्फेक्टेड वाटर, it means that when we drink such type of water which is drunk by the H. pylori infected person, so it can easily enter to our body and affect our body system. The food that is not clean or cooked in a safe way, it's also a big transmission method. When we not cook food well and not clean it well, so in this way this bacteria can enter to our body and cause very critical conditions. Now we are going towards epidemiology. And the prevalence of H. pylori among adults in US is 30% and in other developed countries. So its epidemiology is extended in the US government is about 30% in adult, and other developed countries it's also present up to 30%. It is more common found in adults about 30%. In developed countries, majority of children are infected before the age of 10. It means that जो तरक्की तरक्की पजीर ममालिक है इनमें ये ज़्यादातर 10 साल के कम उम्र बच्चों को इन्फेक्ट करता है. The prevalence in adult is more than 80% before the age of 50. Humans are the only important reservoir of H. pylori. It means that इंसान H. pylori के very important reservoir है. It means that it can exist in a human body and multiply in its growth. Half African have the bacteria. It means that African have bacteria also. This bacteria, its sign and symptoms of H. pylori we discuss about. And the most people have the bacteria without knowing because they don't have symptoms. ज़्यादातर लोगों में ये बीमारी मौजूद होती है क्योंकि इनके सिम्टम्स बज़ाहिरी मालूम नहीं होते, लेकिन इनमें ये बैक्टीरिया मौजूद होता है. So the first one is gastritis. It's a type of a stomach disease and peptic ulcer in stomach and duodenum. Stomach और duodenum में peptic ulcer को भी ये पैदा करता है. Abdominal pain 2 to 3 hours after you eat and in midnight when stomach get empty. ये पेट का दर्द भी इसमें होता है जब आप अमूमन ये 2-3 घंटे के बाद आपको महसूस होगा जब आप खाना खा लेते हैं, और मोस्टली ये रात के वक्त भी होता है जब आपका पेट खाली हो जाता है, तो ये एक दर्द सा आपके पेट में महसूस होता है जो एच pylori है. नो द फोर्थ वन इज़ वेट लॉस. इसमें आपका वज़न भी कम होता है. नॉट फीलिंग हंग्री, और आपको भूख भी नहीं लगती. भूख लगती भी है लेकिन आपका दिल नहीं करता कि कुछ खाएं. तो इट्स मेनली सिम्टम्स ऑफ एच pylori. नोज़िया और वोमिटिंग, आपको उल्टी और चक्कर भी आते हैं. So these are the general signs and symptoms. Now on the diagnosis, how it can be diagnosed. The first one is a blood test, second one stool test, third one is culture, and fourth one is PCR. The first one, blood test for detection of antibiotic against H. pylori. So ये इस टेस्ट में हम एंटीबॉडीज़ को डिटेक्ट करते हैं जो H. pylori कॉज करते हैं. The second one is a stool test for finding H. pylori antigen. This give better result than blood test. So it is mainly found in our stool also. So it will be a prefer and a good method to identify the H. pylori than blood test. Now the third one is a culture for bacterial growth. As you know that culture is a specific phenomena in which we grow bacteria for a specific infection. So we are coming to know that which type of bacteria is found in your stool or in a sample you have given to the doctor or any technologist. So it's a very good method. Specimen for culture, stomach biopsy and stool. एंड इसके लिए हमें जो सैंपल या स्पेसिमेन चाहिए होगा तो हम वो स्टमक से लेंगे या हमारे स्टूल से लेंगे. द फोर्थ वन इज़ PCR, विच इज़ अ modern technique, so it can also be diagnosed it can also be used for the diagnosis of H. pylori. So it's a treatment is a general treatment for H. pylori is use of antibiotics, that is tetracyclines and metronidazole, omeprazole. These are general antibiotics which can be treat to H. pylori infection. And the last one is don't treat for asymptomatic colonization. It means if you have no such type of symptoms, then don't treat this H. pylori with these medicine. So you will need a proper checkup and diagnosis for the H. pylori bacteria. So all this about H. pylori we discuss. Thank you very much. Thank you, sir. You are very uh, and at the last, I would like to thank you, Mr. Dr. Sarneas, sir, which gave us this opportunity to present ourselves. Thank you very much.